Welcome back, everyone, to the deep dive. You know how we do things here. Get our hands on some juicy source material and really, dive deep.
Yeah.
Exactly. So today, it's all about India's medical care system.
Huge topic, right?
Massive. And we've got this document. It's called Unit 2 underscore Supply Side Considerations and Public Policy in Medical Care .pdf. Catchy title, huh?
Really rolls off the tongue. But hey, don't let that scare you off.
Right, because the goal here is to cut through the jargon and really understand what's going on. Like, what are the key challenges? What's actually working? The stuff that matters.
Absolutely. And this document, it really gets into the nitty-gritty of the supply side. Think doctors, hospitals, the whole infrastructure. And then, of course, the policies, how the government's trying to, make things work.
Yeah, let's jump into that because right off the bat, we see this phrase, managed care. And I feel like that can mean a lot of different things depending on where you are in the world. So in the context of India, what are we really talking about?
So in India, managed care is basically this constant balancing act. It's about cost, of course, but also quality and access. And you've got this mix of public and private providers all trying to, make it all work together.
And the document talks a lot about government-sponsored health insurance, GSHI. What's the big idea behind that?
Well, it's all about trying to ease the financial burden on people because healthcare costs, they can be crippling, especially for families who are already struggling.
Yeah, no one wants to go bankrupt because they got sick.
Exactly. So GSHI is trying to make sure people can actually afford the care they need.
And there are some pretty major initiatives under that GSHI umbrella.
You're talking about Ayushman Bharat PM-JAY.
Right. And that's like huge in terms of scale.
Oh, absolutely. Aiming to cover 50 crore people, that's 500 million, primarily focused on hospitalization, the big ticket items, 5 lakh per family annually. It's really quite ambitious.
I mean, 500 million people. That's just mind-blowing.
Yeah, the scale of it is it's immense.
And it's not just the central government, right? Individual states have their own programs, too.
Totally. You've got Arogya in Telangana, and in Tamil Nadu, there's the Chief Minister's Comprehensive Health Insurance. And a lot of these, including PMJAY, emphasize cashless treatment at certain hospitals.
So that removes that immediate financial barrier when you need care?
Exactly.
Okay, so we've got these massive government programs, but then there's also private health insurance. Who are the big players there?
Well, you've got some familiar names like Star Health, ICICI, Lombard, those types. But the private sector has its own set of challenges. Premiums can be really high, and pre-existing conditions are often excluded, which leaves a lot of people vulnerable.
Yeah, that pre-existing condition thing, that's a tough one. But it seems especially problematic in a place like India with such vast economic disparities.
Absolutely.
So how do they even try to manage costs within all these different systems?
One method they're using is capitation payments. Basically, the government sets a fixed rate for certain procedures.
So like price list for healthcare?
Kind of, yeah. They gave the example of $15,000 for cataract surgery under PMJAY.
Okay, so that brings some predictability, right? You know what it's going to cost.
Exactly.
Now, what about gatekeeping, like needing a referral to see a specialist?
That's actually not so common in India.
Really? Why not?
Well, a lot of it comes down to the lack of robust primary care. People often bypass primary care and go straight to specialists, which can drive up costs.
Makes sense. Okay, so managed care in India, it's complex, ambitious, and clearly still a work in progress.
Definitely.
Now, let's talk about the folks actually providing all this care, the healthcare professionals. And, reading through this document, things are looking a little concerning, to say the least.
Well, there are some serious shortages and, a very uneven distribution of healthcare workers.
Like, how bad are we talking?
The doctor-patient ratio is a good indicator. It's about 1 doctor for every 824 people.
Which is not great, right?
Not ideal. The WHO recommends 1 per 1,000, so India is definitely falling short. And then, of course, there's that urban-rural divide.
Ugh, yeah. That seems to be a recurring theme.
It is. 70% of doctors, they're all concentrated in urban areas. But those areas only represent about 30% of the population.
So you've got these huge swaths of rural India with very limited access to doctors.
Right. They rely heavily on ASA workers, the accredited social health activists, and A&Ms, the auxiliary nurse midwives. They do amazing work, don't get me wrong, but they can only do so much.
And it's not just a shortage of doctors in general, it's specialists too, right?
Yeah, and the numbers are pretty stark. For mental health, it's about 1 psychiatrist for every 2 lakh people, and something like 80% of districts have no dedicated mental health professionals at all.
Wow. So what's being done to try and, fix this?
Well, the National Medical Commission, the NMC, they're trying to increase the number of MBBS seats and create incentives for doctors to practice in rural areas.
So more training and enticing them to go where they're really needed.
Exactly. And there's also this push for mid-level providers like community health officers, CHOs. They get specific training to provide a broader range of primary care services, especially in rural areas.
Okay, so multiple approaches to tackle this very multifaceted problem. Let's shift gears now and talk about where a lot of this care happens. Hospitals. And from what I'm reading, India's got a real mix of facilities.
Oh, for sure. Public, private, charitable, all sorts.
So let's start with the public hospitals. What are we looking at there?
Well, you've got everything from, the AIIMS, the All India Institutes of Medical Sciences. Those are like the big names, to your more local PHCs and CHCs, the primary and community health centers.
And they're facing some serious challenges, right?
Big time. Overcrowding, lack of staff, and the infrastructure is often really poor. Like the document mentions that 40% of PECs don't even have electricity.
Oh, wow. That's rough.
Yeah, it's a tough situation.
Okay, so on the other end of the spectrum, we've got the private hospitals. Who are the major players there?
In the cities, you've got these big corporate chains like Apollo, Fortis, Narayana Health. They're all over the place.
And they're the ones with the fancy tech and all that.
Often, yeah. But private care comes with its own baggage, like high costs, sometimes questionable ethical practices.
The document specifically mentioned unnecessary cesarean sections as a problem.
Right, exactly. So it's a trade-off. They're a vital part of the system, but there's a definite need for stricter regulation and oversight.
So how do these hospitals, manage their finances, especially when dealing with government schemes that have these set rates?
It's a lot of cross-subsidization. They basically charge higher rates to private patients to make up for the lower rates they get from government schemes.
Oh, so like a fancy restaurant with a few high-priced dishes that help subsidize the more affordable ones.
Exactly. That's a great way to put it.
Okay, now beyond the people and the buildings themselves, there are some other big, confounding factors that affect healthcare in India. Technology, for example, seems like a huge one.
Oh, it is. And it's this weird contrast. Like in the big cities, especially places like Mumbai and Delhi, you've got cutting-edge stuff, robotic surgery, all that. But in rural areas, they're often lacking even basic equipment.
Yeah, that digital divide really amplifies the urban-rural problem.
No doubt. But there are some bright spots. Telemedicine, for instance, is gaining traction.
Like that East San Giovanni project we talked about earlier.
Exactly. Connecting patients in remote areas to doctors and specialists.
So at least technology is starting to bridge some of those gaps.
Hopefully.
Now, the demographics are shifting too, right? How's that affecting the system?
It's putting a lot of pressure on it. India's got an aging population. Over 8% are over 60 now, and that number is only going up. So the need for geriatric care is just booming.
Yeah, that makes sense.
And then there are the non-communicable diseases, NCDs. We're talking diabetes, heart disease, all those chronic conditions. They're a huge burden and account for over 60% of deaths.
So not just infectious diseases anymore.
Right. It's this whole new set of challenges that need long-term management and prevention strategies.
So we need to shift our focus.
Big time.
Okay, well, that brings us to the second half of this document, which is all about the policy side of things.
Right. The public policy levers for medical care.
Exactly. And they look at both policies within India and also what other countries are doing. Let's start with access. We've touched on Ayushman Bharat, but maybe we can unpack that a little more.
Sure. So Ayushman Bharat, it's got those two main components, right? You've got the PM-JAY, which is the health insurance part, covering secondary and tertiary care. And then there are the health and wellness centers, the HWCs, which are basically upgraded PHCs that provide more comprehensive primary care.
Right. And we saw that PM-JAY has already had a big impact, covering a massive number of hospital admissions.
Oh, yeah, over 15 crore since 2018.
And then there's the National Health Mission, the NHM. That's been around for a while. What are they focusing on?
Well, they're really focused on strengthening the whole public health system, particularly in rural areas.
So things like maternal and child health, vaccinations, that sort of thing.
Exactly. And they heavily rely on the ASHA workers, those accredited social health activists. There are over 10 lakh of them. They're like the essential link between the healthcare system and the community, especially in those hard-to-reach areas.
Yeah, the ASHA workers are amazing, really the backbone of the system in a lot of places.
They do incredible work.
Okay, and we've talked about telemedicine and how it's playing a growing role. Are there specific policies supporting that?
Well, the government's got this platform called Giovanni. It's specifically for remote consultations, and they've had over a crore cases already, so it's really taken off.
Wow, so clearly there's a need and a desire for these types of services.
Absolutely.
Okay, so we've talked about access. What about the other big challenge, cost? What are they doing to try and keep those costs down?
Well, the National Pharmaceutical Pricing Authority, the MPPA, they're the ones who set price caps on essential medications. Things like insulin, stents, stuff that people really need.
So they can't just charge whatever they want.
Right. And then there's this program, the Pradhan Mantri Pariyojan. I know it's a mouthful.
The PMBJP?
Yeah, the PMBJP. They provide generic medicines at much, much lower prices, like sometimes 50 to 90% cheaper.
Okay, that's a real game changer for people who are struggling to afford their medications.
It is.
Are there also policies aimed at preventing these illnesses in the first place?
Oh, absolutely. The Fit India movement, for example, is all about promoting physical activity and healthy lifestyles to reduce the burden of NCDs.
Yeah, gotta get people moving.
Right. And then the National Tobacco Control Program, they're working to reduce smoking and all the health problems come with it.
So there's a focus on prevention as well as treatment.
Definitely.
Okay, so we've got all these different policies in place, but the document also acknowledges that there are some major ongoing challenges.
Right. Like, despite all these efforts, out-of-pocket expenditure, the OPE is still really high.
Around 50%, right?
Yeah, it's crazy.
So people are still paying a huge chunk of their healthcare costs themselves.
Exactly. And that can be devastating for so many families.
And there's still corruption, right?
Sadly, yes. The document mentions issues with fake beneficiaries in the PM-JAY scheme.
So people taking advantage of the system.
Yeah, which undermines the whole thing, right?
Nope, time. Okay, so they've got their work cut out for them.
No doubt.
Now, this document also takes a look at how other countries are handling their healthcare, like the UK with their NHS, the National Health Service. What can India learn from them?
Well, the NHS is a great example of a system that provides universal health care, primarily funded through taxes. But the document points out that in India, the tax base is much smaller. So replicating that model exactly would be really tough.
Yeah, that's a key difference.
But there are still lessons to be learned.
What about Germany? They have that Bismarck model, right?
Yeah, it's based on social health insurance, where both employers and employees contribute. India does have something similar, the employee state insurance, the e-sick, but it's much more limited in scope.
So maybe there's room to expand that kind of system.
Potentially, yeah.
Now, Thailand is often cited as a success story, especially for a developing nation. What makes them so special?
Well, they've achieved almost universal healthcare coverage, about 99%, mainly through taxes. And this is relevant to India because Ayushman Bharat, it has that same goal. So studying Thailand's approach could be really insightful.
Okay, and lastly, there's Singapore, which has that sort of hybrid system.
Right. One of their key features is MediSave. It's basically a mandatory health savings account, so it makes individuals more responsible for their own healthcare costs.
Interesting. Maybe India could incorporate some elements of that.
Possibly.
Okay, so lots of different approaches out there, but as the document emphasizes, India needs to find its own path, right?
Absolutely. One that fits their unique context.
So big picture, what are the biggest challenges facing India's healthcare system?
Well, that urban-rural divide just keeps coming up, right?
Oh, yeah.
75% of the healthcare infrastructure is in urban areas. Well, most of the population isn't.
And we've got the private sector playing such a dominant role.
Right, they handle most of the outpatient and inpatient care. So affordability, quality, ethical practices, those are all big concerns.
And then there's the funding issue.
Huge. India is spending way less than the WHO recommends.
Right.
Like they're at 1.28% of GDP, and the WHO says it should be closer to 5%.
Yeah.
So they're not even close.
So some serious work to be done.
Yeah, no kidding.
But the document also highlights some real success stories within India itself, which is encouraging.
For sure.
Like Kerala, they're doing some really impressive things with their public health system. What's their secret?
It's a few things. Historically high literacy rates have helped, and they've really focused on building a strong network of primary health centers, the PHCs.
Yeah.
And it's paid off. They had the lowest infant mortality rate in all of India.
Wow, that's amazing. So investing in that primary care infrastructure really makes a difference.
It does.
And then there's Tamil Nadu, which has been really successful with their drug procurement program.
Right. They've got this centralized system where they basically buy in bulk. And because of that, they've managed to reduce drug costs by something like 30%.
Smart.
Yeah, really efficient.
And finally, there's the Metanian program in Chhattisgarh.
Oh yeah, they've got these fantastic female community health workers, the Mittenans. They provide basic care, health education, and they really connect people to the formal healthcare system.
And their efforts have led to a dramatic reduction in maternal mortality rates.
A 50% reduction.
So some real wins happening out there.
Definitely. Things to be hopeful about.
Well, as we wrap up this deep dive, what are the big takeaways for our listeners? What should they be thinking about?
Well, I think the main takeaway is just how complex and dynamic India's healthcare system is. You've got these ambitious managed care initiatives, but you've also got huge workforce and infrastructure challenges.
Hmm.
And the government's trying all sorts of different things to improve access, manage costs, and ultimately improve the quality of care for everyone.
Right. It's a system that's constantly evolving and adapting. And there are definitely bright spots, but also some serious obstacles to overcome.
Absolutely.
So here's a final thought for all of you listening. We've talked about those inspiring success stories in Kerala, Tamil Nadu, and Chhattisgarh. So think about this. What single policy change do you think could have the biggest impact in bridging that persistent urban-rural gap in healthcare? And what are the biggest hurdles to making that happen? Food for thought.
And thanks for joining us on the Deep Dive.
Thanks, everyone.